Welcome back to Rural Health News, this segment of Rural Health Today, where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what's most urgent? The Centers for Medicare and Medicaid recently proposed a new rule that will make changes to the state-directed payments that truly have been established to help hospitals across the nation maintain local access to care. State-directed payments are provider payment initiatives allowable by the federal government under Medicaid managed care contracts that allow states to supplement Medicaid reimbursement when it doesn't properly cover the cost of care. And that happens all the time. The new rule proposed by CMS would change how these payments are calculated and distributed, including adjustments to definitions and separating payment terms for states, calculations, and their reimbursement rates, limiting the states in their ability to support hospitals. I'm going to go over 6 areas that are most crucial of negative impact from this legislation, and it's going to address the greater issue that we're still facing, which is the significant losses under H.R. 1, the big, beautiful bill, in terms of $1 trillion that has been deemed taken away from Medicaid. This new proposed rule would place a one-size-fit-all funding, and that's a cap on Medicaid reimbursement at the Medicare rate, which will disadvantage rural hospitals already struggling to operate on inadequate reimbursement models in their respective rural communities. Second, the rule would change the policy on state-directed payments to extend beyond the new statutory requirements established by H.R. 1, which was already devastating under the One Big Beautiful Bill. CMS estimated that the combination of this rule with the statutory changes could reduce Medicaid spending by $775 billion over the next 10 years. The estimation is significantly more than the Congressional Budget Office's original projection of $149 billion under the One Big Beautiful Bill. It is nearly 6 times worse. The proposed rule would also extend to fee-for-service supplemental payments, capping them at 100% of the Medicare rate in expansion states, which, by the way, Michigan is one of. The payment methodologies, such as uniform increases, meaning fixed percentages, or dollar-based add-ons, would be phased out under this rule, though CMS also proposes that states could choose to simply implement minimum or maximum fee schedules within the payment limits, which I assure you will not happen at the state level. The oversight and administrative requirements of state-directed payments would be increased as part of this proposed legislation, placing yet more burden and greater significant burden on hospitals and states to comply. Lastly, long-standing mechanisms of hospital reimbursement would be reduced due to Medicare-based caps. These caps are dangerous. Overall, this rule would mean further reductions in Medicaid reimbursement to hospitals, which would result in many more closures of vital services across this country, especially psychiatric care and obstetrical care. This proposed rule would also exacerbate the rate of hospital closures across the nation, with 734 hospitals already described at risk of closure, leaving many communities in care deserts and putting additional capacity strain on surrounding systems and tertiary centers that simply cannot handle the volume of those patients. These changes put patients at risk, period. There is no way around it. They are extremely harmful to hospitals, to our reimbursement, and especially rural hospitals like Hillsdale. Let your voice be known. Tell Congress today not to advance or push any of these initiatives onto your local hospitals. Now on to the damage report. When a rural hospital closes, its community suffers substantially. Whether it's economic, whether it's healthcare outcomes, whether it is just community engagement and community support, they suffer. Just an hour down the road from Hillsdale Hospital, a community hospital shut its doors on Friday June 19th, signifying the impact of reimbursement reduction and the increased cost of providing care. The hospital in question called ongoing financial challenges facing rural healthcare providers as the primary cause for their closure. What's important for the public to know is these decisions are not made lightly. When a hospital closes, it's only after every possible avenue has been explored. Our closing neighbor hospital is one of many in this United States, losing a desperate battle to keep healthcare services available and rule in our local rural communities. And believe it or not, we do have a success story for today. Despite over 40% of Arkansas residents living in rural areas, rural health clinics across the state often face barriers when accessing quality resources and information available to them. The University of Arkansas for Medical Sciences put together a website called UAMS Rural Health Hub that features all of its rural services related to healthcare, education, and social safety net programs. The site even includes interactive maps of rural health clinics and virtual visit options as well, helping patients avoid unnecessary trips to the emergency department. The goal of the website is to support rural clinics and streamline available information, serving as a more efficient resource than previous website models. Stories like these showcase the value of technology in rural healthcare delivery and how access to information is vital when providing quality care. Thank you to our sources for this episode: the Association of American Medical Colleges, Health and Human Services, the Michigan Health and Hospital Association, Federal Register, the Centers for Medicare and Medicaid, Forvis Mazars, Sturgis Hospital, and UAMS News.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.